Hi guys, I wanted to send out a video just to briefly introduce myself and tell you about me so that I can start to get to know you a little better as well. As you remember, hopefully from the first meeting we had on the health professions floor, my name is Heidi. I'm a faculty member in the Department of Pharmacy Practice. And I am lucky enough to join Kelly in kind of walking you guys through this first year on campus. It's a very exciting time for you, and I feel so lucky to be a part of this adventure with you. Just a little bit about myself. I thought I would send a video just so you can get to know me, and I'm also hopeful that I can get to know you a little bit as well. First of all, I usually ask all the students in the professional pharmacy program to send me a fun fact about themselves. So something really interesting or really unique about themselves, so that I can start to get to know you a little bit better, and it really helps me to remember your name. So I am also going to tell you a fun fact about myself, but in return, I'm hopeful that you will email me a fun fact about yourself, and I am hopeful to get all of your pictures through Kelly, and then I can start to get to know your name and your face so that when I see you on campus, we can be on a first name basis. So to get things started, a fun fact about myself is that I was a member of the very first all-girls hockey team in Fargo. So hockey used to be for the boys only, but then once I got to about 5th grade, we had to play the boys teams, but we had an all-girl team that got to practice and participate. So fun fact about me, and then like I said, if you'll just zip me an email back with a fun fact about yourself, it'll really help me to get to know you. A little bit about me personally. I'm originally from Fargo, so I was born and raised here. My family still lives here. So my nephews are in town, my brother's in town, and so are my parents. And I went to college at NDSU, so I did 2 years of undergrad at NDSU, and then I got my pharmacy degree in 2008 from NDSU. My passion is educating students, whether that be pharmacy students, nursing students, allied science students. It really doesn't matter to me as long as I can get a connection with them. Right now, my course responsibility is in the pharmacy program, and I'll talk about that in a little bit here as well. My passion in pharmacy is community pharmacy practice, because I felt the biggest way that I've been able to make an impact is really talking to patients and teaching them about their medications, about their disease states, and like most healthcare professionals, that's a really big part of our job, and that's really what drove me towards community pharmacy practice. I am a full-time faculty here at NDSU, so I have no clinical appointment at a hospital or a different institution. So I'm here all days of the week, and that's why I get to do fun things like be part of the health professions floor. But I also, on weekends, pick up shifts at a local community pharmacy over in the Hornbachers in Osgood at a site called Medical Pharmacy South. And so I'm the staff pharmacist there. I have interns that work with me on those weekends, and I fill prescriptions for patients, communicate with providers or doctors, and then also counsel the patients on how to take their medications. So pretty fulfilling job here at NDSU, as well as the things that I get to do on the side. So I'm pretty lucky. A little bit about my home life. I have 3 kids at home. Nolan and Jace are 4-year-old twin boys. They are quite the handful at the age of 4, but they make us super busy but super happy as well. They were born at 31 weeks, so they were quite premature. So we spent a lot of time at Sanford. I was actually on bed rest with a twin pregnancy for 49 days. So I got to observe a lot of things that go on in a healthcare setting that when you're there for a quick stay, you don't usually get to experience. So I feel like that has really helped to shape the things that I find important in educating our future healthcare professionals. The boys stayed in the NICU for 5 weeks, and since then on, you'd never know they were premature, but they were about 3 pounds when they were born, and now they're big giants. And then Kitson, she is 10 months old, so I had Kitson last October, and then took a short maternity leave, and now I'm back in action. So she is just learning to walk and trying to keep up with her brothers. A little bit about my kids. Nolan is very into science and exploring things. Jace is our comedian, and not sure what to think about Kitson yet, but she's pretty rough and tumble for a little girl. My husband is a civil engineer in Fargo, so we actually met on NDSU's campus. As you know, the engineering building is pretty close to Sudro, so that's actually how we met. Let's see here. We're all very big Bison fans, so from before our kids could even talk, they were doing the horns. and we do a lot of basketball games with them, and we try and make it to a football game with them once a year as well. In my free time, I like to read books, not textbooks, but fun books. I like to take naps, so my family jokes that I'm the best rester because whenever I get a free minute I try and nap, which I'm sure a lot of you guys do as well with all of your studying time. I love to do landscaping around our house, so oftentimes I'm pulling weeds or making a new plan for the landscape in our yard. We love to travel, so my husband and I try and do a trip together, just the two of us, and then we try and take a little mini family vacation as well. And then I love to play superheroes and Play-Doh and Candyland and anything that the kids are into, I am by default into as well. So we recently had a group of students over to our house for a pizza party from the College of Pharmacy, and we were all in superhero costumes by the end of the night because our kids are so into that stage right now. So let's see here. Some of my professional interests, obviously within the profession of pharmacy, I love serving our patients, but really, I think if I wasn't a pharmacist, I would be a teacher. So I have the best of both worlds. And one of my biggest passions is advising and mentoring students. So if you can imagine kind of your high school counselor and helping students plan their path for their life and find them resources for what they need to make themselves successful is really important to me, as well as helping them identify their strengths and maybe what their best career path for them is, and maybe some resources for scholarships or outreach or job shadowing. Those are things that are really satisfying to me, and I'd love to be able to serve you in that way. I also really enjoy the thought of interprofessional education. This is a big buzzword in the healthcare professions, but essentially it's bringing all forms of the healthcare team together to serve the patient. So it might be a pharmacist and a nurse anesthetist and a respiratory therapist, lab specialist, a nurse practitioner, all working together to serve that patient. And the education piece of that is teaching all of those people to work together and to capitalize on their strengths. So that's something that I really am interested in, and I think that you guys have a really great benefit by living in the health professions floor, is that you'll have contacts with people from all of those different professional avenues, and I think that's going to be really valuable for you, not only now, but in your future as well. I just want to tell you just a little bit about my plan for what I'm going to do with the health professions floor. Like I said, I consider it such an honor to be a part of what Kelly does over there on the health professions floor. This is her third year, I believe, doing this, and only my first year. So I'm really excited to get to know you guys. I plan to have a monthly dinner date where I'll bring Nolan and Jace, our 4-year-old boys, over to the dining center, and I'll invite you guys to have supper with us just to hang out and chat, and I'm sure they'll talk your ear off and ask you all about your school. They'll probably want to tell you about their school. So I plan to have monthly dinner dates, and that'll be a great time for us also to get to know each other, and I can answer any questions you have about NDSU or health professions, job shadowing, internships, etc. I also plan to do really casual chats over in your lounge. So I'll come over with my iPad and I'll just sit and work, and you guys can come chat with me. I'll bring some food, maybe some popcorn, pretzels, pizza, whatever works, and it'll just be a time where you can come hang out with me and we can talk about life in the dorm, or maybe some of your struggles in your classes, or anything that you find important. I'll just be hanging out there and you guys can feel free to interrupt me. I would much rather be talking to you than grading worksheets. So I'll bring it with though, so I can keep busy when there's no one around as well. I'd really like to coordinate some outreach events for the health professions floor. And what I mean by that is maybe talking to Sanford and going over to the child life specialists and seeing how the child life specialists work with the pediatric patients to make their visit more appropriate within the hospital. Or maybe we want to visit over at student health services here on campus so you guys can see what that interprofessional team looks like. Or maybe we decide to visit a nursing home so you can see all the different aspects of healthcare working together to serve that geriatric population. So I'll be working on setting up some outreaches, but I'd also like to hear if you guys have any ideas of what you'd like to do for outreach. So maybe you have a really great idea that you want to go and see the Roger Maris Cancer Center and how the medications are brought there and how the nurses administer the medications and how lab specialists draw lab values and what that looks like. So if you guys have some great ideas, I would really like that, because I want this to be really meaningful for you guys too. So I look forward to zip me an email. I'm going to tell you that my office is in Sudrow Hall. So Thompson Hall, I can actually see it from where I'm sitting right now. And if you look straight across the street from Thompson Hall, as you're looking out the front door, you'll see the RDC, and then immediately to the right of that is Sudrow Hall. And if you come up the stairs and then follow the hallway all the way down until you get to a dead end, if you look to your left, you'll see room number 118, and you'll enter in the door, and then you'll see my office. I'm in Sudrow Hall 118G, and I have a very open door policy. So if I'm in there, my door is always open. Got a candy dish there. I am always looking for student visitors to stop in, whether you're looking for advice or just to say hi. I'd love to see you. I also teach in Sudrow Hall, and that's where I am right now. I'll kind of show you, but I always want to say that I have the coolest classroom on campus. I don't know if everyone would agree with me, but those of you who launched got to see my awesome classroom. But it's actually a licensed pharmacy within Sudrow Hall. We don't actually serve patients, but our pharmacy students, as well as the nursing students, and hopefully in the very near future our allied sciences students, will be participating in activities down here. But I'm just going to show you briefly. This is my classroom. So it's a fully licensed pharmacy. We're all set up for orientation, and it's called the Thrifty White Concept Pharmacy. So we have lots of computer stations, physical assessments, so the blood pressure screenings. We have a dispensing robot. We have actual prescription medications. And then back here, I'll turn the lights on as we go. You'll see that we have simulated IV compounding hoods. We have non-sterile compounding stations where our students make lotions and ointments and creams. They make suppositories. They make capsules, PLO gels, so lots of different things that our students learn. And then last but not least is our sterile compounding room, where our students learn to make IVs. So the medications that nursing will administer are made here in the simulated hospital pharmacy. So pretty cool classroom, and a really fun thing for us to be able to do for our students. So I look forward to meeting you guys. Like I said, please stop in and visit me, and I probably won't be over to your lounge for a couple of weeks. I'll let you kind of get situated, but if you have any questions, obviously you know where Kelly is. I'm just down the hall from Kelly until she moves upstairs, and I'm really looking forward to getting to meet you guys and get to know you and serve you in any way that I can. Zip me an email with your fun fact and maybe any information or ideas you have for outreach, and then stop in and say hi. I look forward to seeing you.